What is a cornea transplant? If you have a vision problem due to a disease of the cornea, your doctor may have told you that you need a cornea transplant to see better. This sounds pretty scary, but as you'll see, a cornea transplant is a safe and effective path back to good vision. So let's get started. The cornea is the clear cover on the front of the eye that has multiple layers, sort of like the windshield of your car. Certain diseases, such as infections and hereditary conditions, as well as scars due to injury, can cloud the layers of the cornea, causing a loss of vision. When this occurs, some or all of the layers of the cornea need to be replaced. How much tissue needs replacing depends on the amount of tissue damaged, as well as how deep. If the damage is severe, due to such conditions as scarring or injury, then most or all of the cornea will need to be replaced. In this case, the damaged cornea is removed and a donor cornea is stitched in place. It's like replacing the lid on a pot. The new cornea, the lid, is cut precisely to match your eye, the pot. Special instruments ensure a perfect fit, and microstitches keep the new cornea in place. In most cases, it's the inside of the cornea that's diseased. A newer technique, known as a desake, can then be used to replace a smaller amount of tissue inside the cornea. The new corneal tissue is inserted through a micro-incision and an air bubble is used to hold it in place. This means no stitches are needed and recovery is much faster. Most of the transplants in the US are now performed this way. In all cornea transplants, the new tissue comes from someone who is kind enough to become an organ donor. The donated cornea is rigorously tested to be certain that it's safe. The desake cornea transplant is performed as an outpatient procedure. It takes about 30 minutes and then you're on your way. You'll be asked to lie on your back and look up at the ceiling for the first 24 hours so your new cornea can settle in. Of course, you can get up to eat and use the facilities. The doctor will see you the next morning to see how you're doing.